Let's take a second to just think about your hands. I mean, they're arguably the most incredible tools we have, right? They connect us to our world in literally thousands of ways every single day. But what happens when that connection starts to seize up? When this amazing, intricate piece of machinery just gets stuck? That's what we're going to dive into.
Have you ever had that feeling you wake up and you try to make a fist and it's just not happening? Or you just feel this nagging stiffness that definitely wasn't there yesterday? Well, it turns out that's a super common feeling, and for a lot of people, it's the very first clue that something's not quite right inside their hands. And look, this isn't just some minor annoyance we're talking about. That little bit of stiffness can make everyday life a real battle. Things we do without thinking, like buttoning a shirt or just grabbing your morning coffee, suddenly become these massive challenges. It really can affect everything: our work, our independence, just our ability to live.
So, let's put a name to it. In the medical world, this whole issue is called the stiff hand. And, that name sounds really simple, but it describes a seriously complex problem where our body's most versatile tool literally gets jammed. Okay, I know, that official definition is a bit of a mouthful, but the key is right in there. It's not just one thing going wrong, it's a total breakdown. All those parts, the joints, the tendons, the muscles, they're all designed to glide past each other, smooth as silk. But when they can't, they start to grind and catch. And that friction kicks off a whole cascade of problems, from pain and weakness to a serious loss of movement. So yeah, to boil it all down to its simplest form, the moving parts of your hand get stuck. That's it. That's the core of the problem. All those elegant, precise components just jam up. And this is exactly why doctors take it so seriously. Our source calls it a multifactorial disorder, which is just a fancy way of saying it has a ton of different potential causes and a huge range of effects. But the bottom line is what matters. It can absolutely wreck a person's quality of life. Okay, so to really understand why a hand jams up, we've got to pop the hood and take a look at the machinery inside. And trust me, it is an incredible, intricate piece of engineering. The sheer complexity is just mind-blowing. We're talking about 27 separate bones, not to mention this incredibly dense web of tendons and muscles, joint capsules, ligaments. Even the skin plays a huge role. And here's the kicker: stiffness can start in any single one of these parts. So the best way to think about it is like a kinetic chain, like a line of dominoes. Every single piece depends on every other piece to work perfectly. So if you get one little problem, a tiny bit of scar tissue on a tendon, for instance, it can throw the entire system off balance and trigger a chain reaction that results in the whole hand getting stiff. And this whole process doesn't just happen instantly. It follows a pretty predictable and destructive path. First comes inflammation. That's the swelling and pain that makes you not want to move it. Then your body kind of goes into overdrive with something called fibroplasia, where it starts laying down a way too much collagen, creating scar tissue. And if you don't stop it, that scar tissue remodels itself into these tight, restrictive bands that can cause permanent, irreversible stiffness. So we get how stiffness happens, but what kicks off that whole damaging process to begin with? All right, let's uncover some of the most common culprits. And here it is. This is probably the single biggest takeaway of this whole explainer. The number one preventable cause of a stiff hand is immobilization. That's right, something as simple as a cast being on for too long or just not moving the hand enough after an injury can be the main trigger. But, of course, it isn't the only cause. The list of potential triggers is incredibly broad. It covers everything from the really obvious stuff, like the trauma from a fracture or a bad crush injury, all the way to chronic inflammation from things like arthritis. But what surprises a lot of people is that stiffness can also be a side effect of systemic issues like diabetes, or even from something neurologic, like a stroke. All right, so we've looked at the problem and the causes, but here's the good news. There is absolutely a clear roadmap for getting that hand back in motion and restoring its function. Generally, treatment heads down one of two main paths. The first stop always is conservative treatment. This is all the non-invasive stuff. We're talking physical therapy, custom splints, specific stretches. Surgery is really the backup plan. It's only considered when all those other methods haven't worked and they have to physically go in and release the tissues that are all jammed up. So when we say hand therapy, what are we actually trying to achieve? Well, it's pretty much a three-pronged attack. Goal 1, increase the hand's basic range of motion. Goal 2, build back the strength that got lost. And the final, ultimate goal that brings it all together, get you back to living your daily life without any of that pain or limitation.
And therapists have a really impressive toolkit to get this done. We're talking everything from custom splints that provide a gentle, constant stretch, to heat therapy to make things more flexible, and even very specific massage techniques to break down scar tissue and get swelling under control. It's a very comprehensive, very hands-on approach. And this whole rehabilitation process is a journey, right? It has phases. It kicks off in the acute phase, where it's all about just managing pain and swelling and starting some very gentle movements. From there, you move into the subacute phase, where stretching and scar management become the focus. And finally, you hit the chronic phase, where the work gets more aggressive, all aimed at getting back full motion and function.
But like with so many things in life, the best treatment isn't really a treatment at all. It's prevention. So how do you do that? Well, the science is pretty clear. After any kind of hand injury, the key is to start moving, gently and properly, of course, as early as it's safe to do so. You have to get swelling under control from day one, and, like we said, avoiding being stuck in one position for too long is absolutely crucial. Getting to a physical therapist quickly isn't a luxury, it's essential. And this quote from the source material just nails it. If you jump on the problem early, the results can be fantastic. But once that stiffness becomes chronic, once those tight bands of scar tissue really set in, it becomes incredibly difficult to undo the damage. Time is absolutely of the essence. So we end up right back where we started, thinking about our hands. They're how we connect to the world around us, how we create things, care for people, and communicate. We've seen just how fragile that connection can be. So the only real question left is, how are you going to protect yours?